men don't take their physical, mental, social, and emotional health as compared to women, because men has this tendency of a macho presentation and a macho kind of lifestyle, and you find that they tend to be more poor in actually doing medical visits or making health visits on a regular basis in Guyana.
What can you do to change that?
So we have started to raise the awareness at the ministry level for men to get themselves screened.
Dr. Jagnarain, you're head of the men's health unit at the Ministry of Health. What is your big concern when it comes to men's health?
A man is not just his prostate and penis. A man is from head to toe. So when we look at a man, we look and see if he has chronic diseases, if he has cardiovascular diseases, cancers, and so forth. But what is important and what is actually coming up from our statistics is that we have noticed that prostate cancer is on the rise. And it's actually there because we have seen that men are turning up in the centers or in the clinics when they're at stage 3 and stage 4. And we now have to, work harder in the health facilities to help men in this situation. So what we want to do is to encourage them to come out and get themselves screened. In the past is that we used to do a digital rectal examination.
What is that?
So it's an examination where the doctor, on the acceptance or approval from the patient, that we basically insert a finger into the anus and try to palpate, and we try to see if the prostate is enlarged, if it's fluctuant, if it's hard, soft, nodular, and so forth. And this can actually help us or guide us as to what are some changes that may occur.
But men don't want a finger going up their anus.
Men has been, I would say, persons are stigmatized in that, having a finger to be inserted. So what we have decided to adopt the same principle that was adopted by the American Urology Association, where we are going to start to do screening by using the prostate-specific antigen test. So this is the prostate-specific antigen test is basically a simple test, simple blood test. You can have a point-of-care testing where you can actually do a simple finger prick, and you can get your your PSA value in 15 to 20 minutes. And this is actually, I would say, more accepted in the manhood realm or the men's society because of their fear. But we should not, say that, we shouldn't get ourselves screened. But I should go back now to the criteria where we actually want to encourage men, all men, at the age of 45, all ethnicity, to get themselves screened using a PSA.
So if more men get tested earlier, they can save their life?
They can save their lives,
Good.
right? So because what happened is that most times a man would start to wait until they develop symptoms like urgency, unable to reach the toilet, hesitancy, blood in the urine, lower back pain, fractures, all of these things can come about, unable to pee. So you want them not to wait until this entire presentation, because you want them to be able to screen prior. But that is just a screening method. A confirmatory diagnosis for prostate cancer is done via doing a biopsy. So it's basically we take a sample or a little piece of the tissue, the prostate tissue, and we put it under a microscope, and we see if there is any abnormality or changes within the cells. So that is the only confirmatory diagnosis. So we want that message to be out there, because sometimes person may have the notion that PSA is actually the diagnostic tool, but is actually the screening tool that we actually use.
And if someone is detected early, they can be treated here in Guyana easily?
If someone is actually treated early, they can be detected in Guyana at all stages. Stage 1, 2, 3 and 4 in Guyana. So we want to encourage persons to go out there and get themselves screened, especially the high-risk persons. The high-risk persons are persons who have a family history of prostate cancer and persons of Afro-Guyanese ancestry. So we want them to screen at an earlier age, which is at the age of 40, all right? Because we found that majority of the persons that were diagnosed with prostate cancer were Afro-Guyanese, and we want to encourage them to get themselves screened.